November is National Diabetes Awareness Month, and here to talk more about that is Dr. Kathleen Bright. She is a primary care doctor and medical director at Bayless Integrated Healthcare. Nice to have you on the show. Thank you so much.
Thank you so much for having me today.
The CDC says that more than 100 million Americans have diabetes or pre-diabetes. Describe diabetes.
Yeah, so it's a big public health challenge for us now because, as you just described, it's everywhere. Especially in Arizona, we have a couple additional challenges. It's a little higher in our Hispanic population. And also in the Pima Indian tribe, we see a little higher incidence as well. So diabetes is very, very common. I deal with it every day as a primary care doctor. And I think it's pretty hard to find a family that it isn't affecting in one way or another, at least with one family member. So diabetes, there's two types. There's type 1 and type 2. And 90% of the diabetics that we care for are type 2.
How do you differentiate?
Sure. So that's our adult onset diabetes. And so type 1 is more of the juvenile diabetes. It's an autoimmune disorder, and it's when the immune system basically attacks the pancreas. And usually it happens in childhood.
Okay.
Sometimes into the 20s, but mainly in childhood. So what we deal with more is this type 2 diabetes, which is an adult onset diabetes, and it's much more related to just your body not recognizing the insulin anymore. So it's not that you're not making it, it's a resistance state in your body. And it's
so it's challenging.
Does
it make patients more susceptible or at higher risk for other medical problems?
Absolutely. So infection risk is higher because the immune system is down when you have diabetes. But also, the tricky part is a lot of times in the initial onset of type 2 diabetes, you don't really know you're sick. And then it's what we call one of our silent killers. So it can start to affect other organs. So it can affect your eyes. We have people who actually lose their eyesight from diabetes, your kidneys. We just don't want our patients to end up on dialysis, amputations. I mean, it ends up heart disease, stroke, all of those risks are increased with type 2.
So the idea is that, obviously we want to encourage patients to proactively manage diabetes on a daily basis. How can they go about doing that?
So early detection is key. So making sure you're established with your primary care doctor, getting screening if you need to be screened so we can diagnose it early, but mainly it's lifestyle. So with type 2 diabetes, with some lifestyle changes and interventions working together, increasing your physical activity, watching your diet, so looking for those white foods that are high in sugar, white foods being yummy stuff, unfortunately, but pasta, tortillas, bread, rice. Not no, but just really moderation. Increasing your fiber with vegetables, healthy eating, some weight loss. Those are all things that you can actually avoid ever being on medication for diabetes if you take control, or avoid getting diabetes at all.
Well, it makes a very big difference, and that brings me to my next question, which is, can you prevent type 2 diabetes?
Yes, and those are all ways. Some of us have some more genetic risk if we have a family member, particularly a sibling or a parent, a first-degree relative, but definitely, especially if you know that you're higher risk based on your genetics, these are the things, these dietary, lifestyle, weight loss, becoming more physically active, get that heart rate up 45 minutes, 4 or 5 days a week, that you can prevent diabetes. And just being aware and definitely getting screening. I think some of my patients are afraid because they don't want to be told they have diabetes.
Right, but it's better to know.
Absolutely, because then we can combat, we can fight back, and hopefully avoid ever having any of those long-term problems we talked about with heart disease, stroke, kidneys,
they go a long way.
Absolutely.
Bayless Integrated Healthcare has 6 locations across the valley. Talk to me a little bit about some of the other services that you provide.
So at Bayless, we're fully integrated. So the primary care services we're talking about now. So in other words, if you come in with a sore elbow, we're going to talk about diabetes, breast cancer, colon cancer. So definitely all your primary care needs, but also your emotional health needs as well. So it's really hard to separate the emotional.
They go hand in hand.
Oh, absolutely. So we have full emotional health services as well. So therapy, counseling, psychiatry, anything that our patients need from an emotional health standpoint, and also motivational counseling too. So if you know you have diabetes or you're at risk, helping motivate our patients to, to change their lifestyle, take control, beat the disease before it ends up causing some long-term problems.
Well, Doctor, we appreciate you sharing your valuable information. Thank you so much for joining us here on Arizona Daily Mix. We appreciate it. BaylessHealthcare.com if you want more information. We'll be right back.
Thank you.